Hello friends, I am Dr. Parthsarthi. I am a senior consultant surgical gastroenterologist, laparoscopic and hepatobiliary surgeon working at KIMS Hospital, Secunderabad. This talk is to create some awareness about a very common problem which people encounter in the society, which comes under the purview of surgical gastroenterology, and that is called hernia. So let us discuss about the various aspects of this problem, like what are the symptoms of hernia, how do we diagnose a hernia, what are the complications which can happen if one does not treat a hernia, how is hernia treated, and what are the latest advances in the treatment of this problem. Hernia is one of the most common problems which presents to the surgical gastroenterologist. So many people do not have an idea as to what this problem is. So let me explain. A hernia is basically a protrusion of any of the internal organs. Like inside the abdomen, we have a lot of internal organs like the intestines, the small intestine, the stomach, the large intestine, the liver, and these organs are very safely packed inside the abdomen by a cylinder of muscle. So God has given a nicely developed cylinder of muscle within which all these organs are kept safely. Due to various reasons, one part of this cylinder of the protective coverage can get weak, and when that happens, whenever the patient coughs or strains, because of that weakness, the organs which are otherwise supposed to be safely packed inside can bulge out through that. In a very simple term, if you can compare the cylinder of muscle to a cycle tire, and all the vital organs which are in the intestines to the cycle tube. The tube is very delicate. The tire is the outer covering which protects the tube. When a tire becomes old, what happens? One part of the tire becomes very weak, and then you will find the tube is bulging out through the tire. And that is exactly how a hernia also happens. So once the tire bulges out, it can hit a stone and the tube can puncture. And that is the same problem which one can encounter with a hernia also. What are the common symptoms of hernia? Like I told you, the first symptom which any patient notices when he or she has a hernia is an abnormal bulge. A bulge can happen more commonly in the belly button area when we call it as a umbilical hernia. It can happen in the groin region. The groin means the place where the abdomen and the thighs meet, the groin crease. And in that region, they can find a bulge which can appear when they cough or strain, and it can disappear or go back inside when the patient lies down. And in the groin region, if a hernia happens, it's called an inguinal hernia. The same bulge can also happen in areas where a previous surgery has been done, like a lady who has undergone a cesarean section or a person who has undergone an appendix operation. Over the scar, they might suddenly start noticing that there is a bulge which appears every time they cough or strain. And this sort of a hernia is called an incisional hernia. So you can have a belly button bulge or a hernia called umbilical hernia. If the same thing happens in the groin, it's called an inguinal hernia. And if it happens over a previous surgical scar, it is called an incisional hernia. So why do some people develop hernia and why don't others develop hernia? So there are some risk factors which makes a person predisposed to form a hernia. What are these risk factors? One is constant heavy straining, especially people who have very long lasting cough, like people who have lung problems or chronic smokers, or people who have very severe problems in passing motions like chronic constipation when every day they have to go and strain at the stools, or people who have problems in passing urine when there is a prostate enlargement, when there is difficulty to pass urine. Every time they go to urinate, they have to force. So once a person daily strains at these activities, either by coughing daily or by straining at the motion daily or straining to pass urine, the abdomen is constantly subjected to an increased pressure, and this can increase the risk factor of developing a hernia. The second reason is a person who has undergone any major abdominal operation. Like I told you, any cut on the abdominal wall, on the muscle, once it is stitched, it can no longer be the same way as it was before. So these stitches over a period of time, because the person has become very obese, or because the muscles have become weak, or because of poor nutrition, the stitch line can slowly give way and the scar can break and a hernia can form through that. There are other reasons where hernias can also form by birth. Like you can have small babies being born with a hernia already present. Especially this happens in the belly button region, because the belly button is the last part which closes the connection between the mother and the child. And if that doesn't close early, the baby can be born with a belly button or an umbilical hernia. In many cases, this automatically resolves, but if it doesn't, it needs to be fixed. Babies similarly can also be born with a groin hernia congenitally. That's called a congenital inguinal hernia. So these are the common risk factors why someone would develop a hernia. So most commonly the patient, once they notice a bulge or when they have pain over that bulge, they come to the doctor to check what it is. Many times they do not know that it's a hernia. Hernia is a very easily diagnosed problem in the outpatient clinic. Most of the time it does not need any advanced tests or scannings to diagnose a hernia. So once the surgeon or the doctor examines the hernia, he'll be able to make out that whether the hernia is present or not. Further, to classify what is the severity of the hernia, what is the type of content, and to plan surgery, the patient might need a test like an ultrasound scan or a CT scan to further delineate other factors for technical aspects. But to diagnose a hernia, generally an outpatient visit to a doctor is usually enough to find out a hernia. People with hernia have to understand that hernia is a problem which occurs because there is a hole in the abdominal wall. So there is a defect. It is very similar to the seam of your shirt or a pant getting broken and the stitch opens. So as you would have guessed already, medicines cannot get this thing fixed again. So no type of medicine can fix a hernia. Hernia is a surgical problem, and the treatment of hernia is done through surgery, wherein the abnormal gap is again stitched back and another mesh is placed over the stitch to strengthen the stitch line and to prevent the hernia from happening again. So there are various ways of treating a hernia surgically. The time tested method is an open hernia repair, where a long cut is made on the hernia region. Whatever intestines have protruded out is again sent back into the abdominal cavity, put in their original place. The abnormal defect is closed with sutures and a mesh is placed to strengthen the suture line. So this involves an incision, a prolonged recovery time, and because there is another cut made on the abdomen, this can also cause future hernias. A large number of hernias these days are treated without the need for a long cut. They are treated by means of a laparoscopic or robotic repair, wherein there is no incision made on the abdomen. With the help of keyholes done through the belly button or elsewhere in the abdomen, a camera is passed inside. From the inside, the hernia contents are pulled back into the abdomen, put in their original place. The hole is suture closed and a mesh is placed from inside. So what are the advantages of this technique? Is you avoid a long cut. The pain involved in this treatment is much lesser when compared to a conventional open operation, and the chance of wound infection is much lesser. The time to get back to work, because there is no major cut, there is no need for elaborate dressing or extensive bed rest. The person can resume back his normal activities much earlier when compared to a conventional operation. How do you prevent hernia? Number one, how do you prevent a hernia from reoccurring after you have undergone a hernia operation? The first point, how does one prevent a hernia from occurring, is avoid prolonged straining, be it straining continuously at motions. When you have constipation, it is better to get it treated so that the motion is soft, by including good amount of fiber in the diet, taking adequate fluids, and if it doesn't respond to these, to use a medical supplement as suggested by your doctor so that you do not strain at stools. Second, avoid smoking. Smoking can predispose to hernia in two ways. One, smokers generally develop chronic cough, and if they keep coughing every day over a period of years, the constant pressure of the cough on the abdomen will weaken the abdominal wall and lead to hernia formation. Second, the tissue of a smoker is of much poorer quality than the tissue of a non-smoking individual. So even if a smoker has a hernia and undergoes an operation for hernia, the chance of the hernia healing completely is much lesser than a non-smoker. That is the reason when we want to do a surgery of hernia for a smoker, we make it a point to ensure that he or she stops smoking before the operation and continues to quit smoking after that, because only then the healing power is better. The type of body cement or the collagen which is formed is of good quality and the hernia doesn't recur. Third, if there is a problem of straining during urination, this especially happens in people who are above 60 years when their prostate becomes enlarged, elderly men, because of prostate enlargement, without realizing, they will continue to strain at urine, and once this happens over a period of years, they also develop hernia. And excessive weight training without due guidance is also harmful, and good nutrition with adequate protein intake is very important for building the muscle strength. This is very important especially for ladies during and after their pregnancy, when they deliver, because pregnancy is a time when the abdominal muscles are stretched to a large extent and they have to get back their tone. Having exercises to regain the abdominal tone, having a good high protein diet is very important to strengthen the abdominal muscles in women so they don't develop a hernia in their later life.